close the door for privacy, and I'm going to wash my hands. Hi, my name is Sarah. I'm going to be your nurse for today. Can you please verify your name and date of birth? Carl Rogers, date of birth 3/15. Okay, do you have any allergies, Mr. Rogers? No known allergies, and the patient is not wearing an allergy band. MR number 771-8854, 771-8854. Okay, Mr. Rogers, we're going to be doing a full head-to-toe assessment today. I'm going to start off with taking a set of vital signs. So we have your temperature here, goes under your tongue. It's coming back at a 99.9. Okay. And here on the screen, blood pressure 148/79. Your O2 sat is reading 96% on room air. Your heart rate is 91 beats per minute, and I'm gonna sit here and take your respirations for 30 seconds. So 30 seconds has passed and the respirations are 18. Are you in any pain today, Mr. Rogers? Okay, yes. And on a scale from 1 out of 10, can you state what your pain level is? States it was a 3 out of 10. And where is that pain? Right heel. Okay. Can you describe the quality of that pain? States that it's sharp. Does it radiate anywhere? Okay, it's non-radiating. Does anything make it better? He states pain meds make it better. And he could use a little something extra to be more comfortable, to get enough rest. Okay, and what makes it worse? Touch makes it worse. Okay. Alrighty. Okay, do you know where you are today, Mr. Rogers? Fortis Hospital. And do you know why you're here? Uncontrolled diabetes and a wound. Yes. And do you know what date it is today? It's 5/20. Okay. So I'm gonna get started on my head to toe. Pen light is. I don't know where my pen went. Okay. Shine this in your eyes. Okay, and follow the pen light. Okay, pupils are equal round and reactive to light. I'm gonna check your oral mucosa. Mucosa is pink, moist, and intact. Okay, gonna check for your skin, if it's tenting or non-tenting, and it is non-tenting. Have you had a cough, Mr. Rogers? Yes? Okay. Are you coughing anything up? Okay, he said yes, so it's a productive cough. What is the color of that sputum? White? Okay, and the consistency? Frothy and thin. And about how much do you think you could cough up if you had a little medicine cup? 5 milliliters? Okay. So I am going to listen to 8 places on the front and 10 on the back. I'm going to inspect the chest to see if it rises symmetrically, and it does. Okay, lung sounds are clear, they're even and unlabored, and I would listen to 10 places on the back and I would find the same findings as well. Okay, so moving on to your heart, I'm just going to take a listen. Starting in the right, the second intercostal space to the right, which is the aortic. S1, S2 noted. Second intercostal space to the left is the pulmonic, S1, S2. Third intercostal space to the left is Erb's point, S1, S2. Fourth intercostal space to the left is tricuspid. S1, S2 noted. Fifth intercostal space, midclavicular line, is the mitral. S1, S2 noted. Now I would flip this over and listen for the apical pulse for a full minute. So a full minute has gone by. The apical pulse is regular and 91 beats per minute. Okay. Going to assess the pulses, starting with the brachial pulse on both sides, checking for symmetry, +2 and regular. Radial pulse, checking for symmetry on both sides, +2, regular. Checking for capillary refill on both sides, less than 3 seconds. Okay, can you squeeze my hands for me, push down, and pull up? Okay, so the patient's strength on the upper extremities on both sides are a +5. Okay, Mr. Rogers, when was your last bowel movement? Last night? Okay, and the color? Brown. The consistency? Soft. Okay, and about how much? About medium. Was there any unusual odor? No? Okay. All right, so I'm going to inspect the abdomen. It is non-distended. Going to listen to 4 quadrants. Starting with the lower right quadrant. Vowel sounds are active. Upper right quadrant. Vowel sounds are active. Upper left quadrant. Vowel sounds are active. Lower left quadrant. Vowel sounds are active. Okay, I'm going to palpate your abdomen. Can you tell me if you have any pain or tenderness? Starting with the lower right quadrant. No. Upper right quadrant. No. Upper left quadrant. No. And lower left quadrant. And the patient denies any pain or tenderness when palpating. I'm going to assess the IV site. The dressing is clean, dry, and intact. It is dated, and there's no redness, swelling, or infiltration noted. Okay. So, when was the last time that you urinated? Oh, it doesn't say. Okay, you don't remember. What was the color? Straw color. The clarity. Is it clear? Was it cloudy? It was clear. Okay. Any unusual odor? None. Okay. And about how much? About a half full of a urinal? Okay. And then, did you experience any pain, urgency, or change in frequency? And the patient denies any of those 3 things. Okay. I'm going to lift up the gown and just assess, checking for any lesions, edema, abnormalities, discharge, or sores. And there is none of that. So we're going to put that back down. I'm going to move on to the lower extremities. I'm checking for edema on both sides. And there is no edema. Checking for skin temperature. The temperature is warm, the skin is dry and intact, and there's no presence of breakdown, and the skin color is appropriate to ethnicity. So I'm going to move down here to the lower. Yeah. Oh, okay. So before I go down to the feet, I'm going to wash my hands and put on gloves. Okay, I'm going to assess the pulses, starting with the dorsalis pedis pulse, checking both sides for symmetry. And it is +2, regular. Posterior tibialis pulse on both sides is +2, regular. Checking for capillary refill, which is less than 3 seconds on both sides. Okay, can you push down and pull up? Okay, and also while I'm down here, I would assess the wound as well to see if there is any excess drainage or cern sanguineous fluid. So I would take my gloves off, wash my hands. All right, Mr. Rogers, we are all finished. I'm going to put your bed down for safety, your rails up. Is there anything else I can get for you? No? Okay, here's your call bell. If you need anything, just let me know. And I'm going to wash my hands and open the door for privacy.